So today it's approximately 10 weeks since we injected Kybella, and we have our first patient here today. And so I'm just going to ask her questions and she's going to honestly reply. How did Kybella work for her or did not work for her? So we're going to begin with the first question. So how was your experience with Kybella? Was it something that you expected to be? Was it simple? Was it easy? So in the first place, was it painful when we injected?
I had more fear of it at first, but when the process began, the pain was not extreme. It was on a level from 1 to 10, probably about a 5.
Okay. And then once the injection was done, I presume then there was no further pain?
There was, I iced it
Yes.
for a while. After icing it, the pain probably lasted for a half a day.
Okay.
And the sensitivity probably a day and a half.
Okay. Much swelling, much bruising?
The swelling probably a day and a half to 2.
Okay.
And after that, by the 3rd day, it was all gone, just numb.
Perfect. And so now that 10 weeks have gone by, you had your first set of injections. What do you think, honestly? Is there a difference? Or is there no difference? Or is there a big difference? What are your thoughts?
There
Just
is
let them know.
a big difference, and I'm extremely happy with the outcome.
So does that mean that you're going to have one more injection today?
I am. I'm going to go through one more procedure, and after that, I think I'll be extremely happy with the outcome.
All right. So we're now going to do the second set of injections today, and we are going to go ahead and begin the process in a few seconds. So we're going to do the second set of Kybella injections today. And the step number 1 is to mark out the area where we want to go ahead and do this procedure. We also have this tattoo marks that we can place, a kind of a grid that we're going to place on her neck that allow us to do that. So I'm going to demonstrate a little bit about it and then begin with the process of actually injecting it. So all we do is place this, and then we're going to make this wet, and as I'm making this wet, the marks will get transferred from this marker onto the skin. And it works very effectively and creates a very nice grid, so that gives me a map as to how much I'm injecting and where, in a very systematic, very organized fashion. So the end result is a symmetrical, nice looking neck and not something that looks odd. And there we have all the marks laid up. And we're going to begin the process shortly about injecting into her neck. So now that we have got the grid all marked out and I have the Kybella drawn, an extremely fine needle, we're going to begin the process of gently injecting 0.2 mils of the Kybella solution into each of those dots as I see them. And as I do it very shortly, in approximately a minute, minute and a half, the procedure would be over. Quick, simple and easy. I'm going to demonstrate that now. And all I do is going ahead and systematically injecting the small quantity of this medication that is going to go ahead and allow the fat that we have over here gradually dissolve and disappear, creating a nice smooth outline for the neck.